Hi everyone, and welcome to this tutorial on Epic ClinDoc. I'm Sara, and in this video, I'm going to walk you through the basics of using Epic ClinDoc as a nurse. First, let's go through these definitions. Epic ClinDoc is an electronic health record system used by many healthcare organizations. It allows clinicians to document patient care, track clinical information, and communicate with other members of the care team. As a nurse, you'll be using Epic ClinDoc to document your patient interactions, including assessments, interventions, and outcomes. To get started with Epic ClinDoc, you'll need to log in using your unique credentials. Once you've logged in, you'll be taken to the Epic ClinDoc homepage, which displays a variety of tools and resources that you can use to manage your patient care. The first thing you'll want to do when using Epic ClinDoc is to search for your patient. You can do this by using the patient search function, which is located in the upper left-hand corner of the screen. Simply enter the patient's name, medical record number, or other identifying information, and click Search. Once you've found your patient, you can click on their name to open their chart. The patient chart is where you'll spend most of your time in Epic ClinDoc. It contains a variety of tabs and sections that allow you to document different aspects of the patient's care. One of the first things you'll want to do when working with a patient is to complete an assessment and develop a care plan. You can do this by clicking on the Assessment and Planned tab in the patient chart. Here, you can document the patient's medical history, current symptoms, and any other relevant information. You can also develop a care plan that includes goals, interventions, and outcomes. Another important aspect of patient care is tracking vital signs. You can do this by clicking on the Vital Signs tab in the patient chart. Here, you can record the patient's blood pressure, heart rate, respiratory rate, temperature, and other vital signs. You can also view the patient's vital sign trends over time to identify any changes or trends. As a nurse, you'll also be responsible for administering medications to your patients. You can document medication administration by clicking on the Medications tab in the patient chart. Here, you can view the patient's medication orders, document medication administration, and track any adverse reactions or side effects. Another important aspect of patient care is tracking and completing orders. You can do this by clicking on the Orders tab in the patient chart. Here, you can view the patient's current orders, document completion of orders, and track any pending orders. Finally, you'll want to document any notes or observations you have about the patient. You can do this by clicking on the Notes tab in the patient chart. Here, you can document your observations, track any changes in the patient's condition, and communicate with other members of the care team. Here are some key terms related to Epic ClinDoc and their definitions and uses. ClinDoc or clinical documentation is a module in Epic where clinicians document detailed patient care information, such as their history, review of systems, physical examination, and their plan of care. Flowsheets are where nurses record and view routine care activities and measurements, such as vital signs, input-output data, and assessment data. Flowsheets provide a longitudinal view of patient data over time and are typically used for tracking trends in patient health. Notes are where providers document their subjective observations, objective findings, assessments, and plans in a narrative format. Notes in Epic ClinDoc are structured and can be templated to help standardize documentation practices. Navigators are workflows in Epic that guide clinicians through complex or multi-step tasks, such as patient admissions or discharges. There are specific navigators for different activities, like the Admission Navigator, Code Blue Navigator, or Rapid Response Navigator. Medication Administration Record. The MAR is a feature in Epic where nurses can document the administration of medications to patients. It provides a record of all medications a patient has received, including the date, time, dosage, route, and the person who administered the medication. In Basket is Epic's internal messaging system. Nurses can use In Basket to communicate with other members of the care team, receive notifications about patient status changes, lab results, orders, and other important information. Snapshot is a feature in Epic that provides a quick overview of key patient information. It can include details such as the patient's primary diagnosis, allergies, current medications, recent lab results, and care team members. Patient lists are lists of patients that a nurse is caring for. They can be organized by unit, room, provider, and other criteria. Nurses can use patient lists to keep track of their tasks for each patient. Chart Review is a feature in Epic where nurses can review a comprehensive history of a patient's care, including notes, lab results, imaging studies, medications, and other data. It allows for a holistic view of the patient's care and progression. Order transmittal. This is the process of communicating orders from the provider to the appropriate department or staff member who will fulfill the order. For nurses, this could involve tasks like administering medications or performing procedures. Care plan. This is a detailed plan of care for a patient that is developed by the care team. It outlines the patient's goals, interventions, and planned outcomes. In Epic ClinDoc, the care plan is a collaborative tool that can be viewed and updated by all members of the care team. Problem list. This is a list of a patient's active and resolved health issues. The problem list provides a concise overview of a patient's health status and is regularly updated throughout a patient's care. SmartTools. These are features in Epic that help automate and standardize documentation. They include things like smart text, templated text, smart phrases, predefined phrases or paragraphs, and smart links, automatically pull in up-to-date patient data. SmartTools help save time and improve the consistency of documentation. SmartForms. These are structured documentation forms in Epic that guide clinicians through a specific workflow or process. They are often used for assessments or other types of routine documentation. SmartSets. These are order sets in Epic that allow clinicians to order multiple related items at once, based on a certain condition or situation. For example, a SmartSet for pneumonia might include orders for certain lab tests, antibiotics, and imaging studies all in one set. After visit summary, AVS. This is a document that summarizes a patient's visit, including the care received, instructions for follow-up, prescribed medications, and other important information. Nurses can customize the AVS in Epic to provide relevant, patient-friendly information. Best Practice Advisory, BPA. This is a feature in Epic that alerts clinicians to evidence-based best practices or potential issues during the ordering or documentation process. For example, a BPA might alert a nurse if a medication being ordered could interact with another medication the patient is taking. Storyboard. This is a feature in Epic that provides a snapshot of a patient's information on one screen, including things like the patient's age, gender, vital signs, current medications, allergies, and other relevant details. Care Everywhere. This is a feature in Epic that allows healthcare organizations to share patient records securely with other healthcare organizations, even if they use a different EHR. For nurses, this can provide valuable information about a patient's past care and medical history. Reporting Workbench. This is a reporting tool in Epic that allows clinicians and administrators to create, run, and manage operational reports. These reports can help with tracking quality measures, managing patient populations, and identifying areas for improvement. Wrench Icon. This is a feature in Epic that allows users to personalize their workspace, such as changing the layout of their screen, adding or removing columns and lists, and customizing other aspects of the Epic interface. Rooming. This is a process in Epic where front desk staff or nurses can document the patient's arrival, update basic patient information, take vital signs, and perform other tasks to prepare the patient for their visit. Order reconciliation. This is a process in Epic where clinicians can review and reconcile a patient's medications, allergies, and other orders. This is typically done at transitions of care, such as admission, transfer, or discharge. Preference list. This is a personalized list in Epic where clinicians can save their commonly used orders, diagnoses, or other items for quick and easy access. To-do list. This is a feature in Epic where users can view and manage tasks that need to be completed, such as medication administration or patient education. Hyperspace. This is the name of the graphical user interface of Epic that healthcare providers use to interact with the system. Patient Station. This is a module in Epic where administrative staff can manage patient registration, insurance, and other non-clinical information. Media Manager. This is a feature in Epic where users can view and manage images and documents, such as scanned consent forms or images from a patient's electronic medical record. Speed buttons. These are customizable buttons in Epic that allow users to quickly access frequently used actions or screens. Sticky Note. This is a feature in Epic where users can leave notes or reminders for themselves or other members of the care team. Synopsis. This is a feature in Epic that provides a brief summary of a patient's current and past medical history. Timeline. This is a feature in Epic where users can view a chronological history of a patient's care, including visits, admissions, and results. UserWeb. This is an online portal for Epic users where they can access resources, training materials, and other information about Epic. Workspace. This is the term used in Epic for the area where a user performs their tasks. Each user's workspace can be customized to their role and preferences. Bedside Mode. This is a feature in Epic that optimizes the Epic interface for use at the patient's bedside, such as during bedside shift report or patient education. MyChart. This is a patient portal in Epic where patients can view their medical records, communicate with their care team, schedule appointments, and perform other tasks. Order Panel. This is a feature in Epic where providers can enter orders for medications, lab tests, procedures, and other interventions. Work Queue. This is a feature in Epic that organizes tasks that need to be completed, such as coding and billing tasks, follow-up on orders, or managing referrals. Rover. This is a mobile application for Epic that allows clinical staff to access patient information and perform tasks on a mobile device. Haiku. This is a mobile application for Epic that allows providers to access patient information, communicate with the care team, and perform other tasks on a smartphone. Kanto. This is a mobile application for Epic that is specifically designed for use on a tablet. Break the Glass, BTG. This is a feature in Epic that allows authorized users to access sensitive information in a patient's record, such as information related to substance use, mental health, or HIV status. Accessing this information requires an additional level of authentication and is logged for auditing purposes. Data Courier. This is a tool in Epic that allows healthcare organizations to transfer data between different Epic systems. This is useful for organizations that have multiple locations or are part of a larger healthcare network. Care Everywhere Viewer. This is a feature in Epic that allows users to view patient records from other healthcare organizations that use Epic. This can be useful for clinicians who are treating patients from out of town or who have recently transferred care. HIM, Health Information Management. This is a department within a healthcare organization that is responsible for managing patient records, including ensuring the accuracy and completeness of documentation, ensuring compliance with regulations, and managing requests for records. Patient Portal. This is a feature in Epic that allows patients to access their medical records, communicate with their care team, schedule appointments, and perform other tasks. The patient portal is typically accessed through a web browser or mobile app. Patient safety. This is a key concept in healthcare that refers to the actions and systems in place to prevent patient harm. Epic ClinDoc can support patient safety through features like alerts, warnings, and best practice advisories that help clinicians make informed decisions and avoid errors. Dashboard. This is a feature in Epic that displays real-time data and metrics, such as patient flow, bed occupancy, and throughput times. Dashboards can be customized to provide visibility into the metrics that are most important to the user. Epic Care Link. This is a feature in Epic that allows healthcare providers who are not part of the same organization to access patient records securely. Charge Router. This is a tool in Epic that helps ensure that all chargeable services are billed appropriately. The charge router maps each service to the appropriate billing code based on the patient's insurance coverage and other factors. Patient Education. This is a feature in Epic that allows clinicians to create and distribute educational materials to patients, such as discharge instructions or medication information. Order Sets. This is a feature in Epic that allows clinicians to order multiple related items at once, based on a certain condition or situation. For example, an order set for pneumonia might include orders for certain lab tests, antibiotics, and imaging studies all in one set. In Basket. This is a feature in Epic that allows users to manage messages, tasks, and alerts that are related to patient care. In-basket messages can be sorted, filtered, and prioritized based on urgency. MyChart Care Companion. This is a feature in Epic that allows patients to receive reminders, education, and other support between visits. Care Companion can be customized based on the patient's condition and preferences. MyChart Proxy Access. This is a feature in Epic that allows parents, guardians, and other authorized individuals to access a patient's medical records and manage their healthcare. Epic MyChart Care Coordination. This is a feature in Epic that allows patients to share their medical information with family members, caregivers, and other providers, helping to facilitate coordinated care. Epic Patient Timeline. This is a feature in Epic that displays a visual timeline of a patient's care history, including past appointments, procedures, lab results, and other events. This can help clinicians get a quick overview of the patient's care trajectory. Now, I am going to work with you through some practice questions. I will provide you the correct answers after reading all the options to you. What is Epic ClinDoc primarily used for? A. Scheduling appointments. B. Documenting patient care. C. Billing insurance. D. Designing hospital layouts. Correct answer, B. Documenting patient care. What is a smart phrase in Epic ClinDoc? A. A secret password. B. A customized phrase for quick documentation. C. A verbal command for voice recognition software. D. A chatbot for patient engagement. Correct answer, B. A customized phrase for quick documentation. What does MAR stand for in Epic ClinDoc? A. Medical Acquisition Record. B. Medical Administration Record. C. Medication Administration Record. D. Medication Acquisition Record. Correct answer, C. Medication Administration Record. What is an interdisciplinary plan of care, IDPC? A. A plan outlining patient goals and interventions from all disciplines. B. A plan for managing a hospital's departments. C. A plan for hospital evacuation during emergencies. D. A plan for educating patients about their conditions. Correct answer, A. A plan outlining patient goals and interventions from all disciplines. What does a flowsheet in ClinDoc allow you to do? A. Document and view data points over time. B. Flowchart the care process for a patient. C. Create a visual representation of the hospital structure. D. Track the movement of patients through the hospital. Correct answer, A. Document and view data points over time. Which feature of ClinDoc helps providers adhere to guidelines and prevent errors? A. Smart Text. B. Clinical Decision Support, CDS. C. Flowsheets. D. In-basket messaging. Correct answer, B. Clinical Decision Support, CDS. What is the purpose of the in-basket in ClinDoc? A. To hold documents for scanning. B. To send and receive messages and tasks. C. To store patient belongings. D. To order supplies for the hospital. Correct answer, B. To send and receive messages and tasks. What is SmartText in ClinDoc? A. A pre-built template for documentation. B. An intelligent messaging system. C. A text message alert system for patients. D. A tool for text-based patient education. Correct answer, A. A pre-built template for documentation. In ClinDoc, what is the Snapshot page? A. A page for uploading patient photos. B. A page with a quick overview of the patient's status and recent activity. C. A page for viewing X-ray images. D. A page for storing image-based medical records. Correct answer, B. A page with a quick overview of the patient's status and recent activity. What is the purpose of order management in ClinDoc? A. To manage cafeteria orders for patients. B. To manage orders for medical supplies. C. To manage orders for tests, procedures, and medications for patients. D. To manage the order in which patients are seen. Correct answer, C. To manage orders for tests, procedures, and medications for patients. What does acknowledging an order mean in ClinDoc? A. Confirming receipt of an order. B. Approving a patient's request for food or amenities. C. Accepting a delivery of supplies. D. Agreeing to work a scheduled shift. Correct answer, A. Confirming receipt of an order. What does narrative documentation refer to in ClinDoc? A. Writing a story about a patient. B. Creating a narrative for a hospital marketing campaign. C. Documenting patient care using free text entry. D. Documenting the history of the hospital. Correct answer, C. Documenting patient care using free text entry. What is the purpose of handoff documentation in ClinDoc? A. To document the transfer of an object from one person to another. B. To document the transfer of responsibility for a patient from one healthcare provider to another. C. To document a patient's transfer from one room to another. D. To document the transition from paper records to electronic records. Correct answer, B. To document the transfer of responsibility for a patient from one healthcare provider to another. What is the purpose of the problem list in a patient's chart in ClinDoc? A. To list any problems the patient has had with the hospital. B. To list any difficulties the patient has had with their insurance. C. To list the patient's current and past medical issues. D. To list any complaints the patient has about their care. Correct answer, C. To list the patient's current and past medical issues. What is the purpose of the medication list in a patient's chart in ClinDoc? A. To list all medications available in the hospital. B. To list all medications the patient has ever taken. C. To list the patient's current and past medications. D. To list any medications the patient is allergic to. Correct answer, C. To list the patient's current and past medications. What information can be found in the recent results section of a patient's chart in ClinDoc? A. Results of recent elections in the hospital. B. Results of recent surveys about patient satisfaction. C. Results of recent audits of the hospital. D. Results of recent tests and procedures for the patient. Correct answer, D. Results of recent tests and procedures for the patient. What does co-signing an order mean in ClinDoc? A. Signing a birthday card for a patient. B. Agreeing to a plan of care with a patient. C. Confirming and approving an order placed by another healthcare provider. D. Sharing a patient's medical record with a new healthcare provider. Correct answer, C. Confirming and approving an order placed by another healthcare provider. What kind of information can be documented in a flow sheet in ClinDoc? A. The flow of traffic through the hospital. B. The flow of a surgical procedure. C. The flow of a patient's stay from admission to discharge. D. Serial measurements over time, such as vital signs, intake and output. Correct answer, D. Serial measurements over time, such as vital signs, intake and output. What is the purpose of progress notes in ClinDoc? A. To note the progress of the hospital's expansion project. B. To note the progress of a staff meeting. C. To provide detailed descriptions of a patient's health and the care they've received over a certain period. D. To note the progress of a research study. Correct answer, C. To provide detailed descriptions of a patient's health and the care they've received over a certain period. How does a smart link function within Epic ClinDoc? A. It connects to smart devices in the hospital. B. It pulls in data or text automatically into a note based on certain conditions. C. It allows direct internet browsing from the system. D. It is a tool for managing hyperlinks in patient education materials. Correct answer, B. It pulls in data or text automatically into a note based on certain conditions. What is the after-visit summary, AVS, in Epic ClinDoc? A. A summary of the hospital's activities after a visit from a health inspector. B. A summary of a patient's health status after a visit to a specialist. C. A document that provides a summary of the patient's visit, including care instructions and follow-up information. D. A report of a patient's satisfaction with their visit. Correct answer, C. A document that provides a summary of the patient's visit, including care instructions and follow-up information. How does the patient summary function in Epic ClinDoc? A. It provides a brief summary of the hospital's patient capacity. B. It provides a brief summary of all patients in a particular unit. C. It provides a comprehensive snapshot of an individual patient's status and care, including lab results, medications, problems, and allergies. D. It provides a summary of the patient's financial account. Correct answer, C. It provides a comprehensive snapshot of an individual patient's status and care, including lab results, medications, problems, and allergies. How can InBasket be used in Epic ClinDoc? A. To send and receive messages and tasks. B. To collect patient payments. C. To manage hospital inventory. D. To schedule patient appointments. Correct answer, A. To send and receive messages and tasks. What is a key aspect of chart review in Epic ClinDoc? A. Reviewing a chart of the hospital's staffing levels. B. Reviewing a chart of the hospital's budget. C. Reviewing a patient's health history and current health status. D. Reviewing a chart of a patient's meal preferences. Correct answer, C. Reviewing a patient's health history and current health status. How does a nurse typically begin her shift using Epic ClinDoc? A. By checking the hospital's stock levels. B. By checking the cafeteria menu. C. By reviewing her assigned patients and patient lists. D. By sending a message to all her colleagues. Correct answer, C. By reviewing her assigned patients and patient lists. What tool can a nurse use to document a patient's vital signs in Epic ClinDoc? A. SmartText. B. SmartPhrase. C. Flowsheets. D. InBasket. Correct answer, C. Flowsheets. If a nurse needs to give a medication to a patient, where would she find this information in Epic ClinDoc? A. MAR, Medication Administration Record. B. Snapshot. C. Plan of Care. D. InBasket. Correct answer, A. MAR, Medication Administration Record. What tool does a nurse use to hand off a patient to the next shift in Epic ClinDoc? A. Handoff tool. B. In basket. C. Notes. D. Snapshot. Correct answer, A. Handoff tool. Where would a nurse document a patient's intake and output in Epic ClinDoc? A. In basket. B. Snapshot. C. Flowsheets. D. Notes. Correct answer, C. Flowsheets. If a nurse needs to communicate with a doctor about a patient's condition, what feature of Epic ClinDoc would she use? A. Flowsheets. B. In basket or secure message. C. Patient lists. D. MAR. Correct answer, B. In basket or secure message. How would a nurse acknowledge orders for her patients in Epic ClinDoc? A. By using the Acknowledge Orders activity. B. By sending a message through In basket. C. By documenting it in the patient's notes. D. By updating the patient's problem list. Correct answer, A. By using the Acknowledge Orders activity. Where would a nurse find the patient's plan of care in Epic ClinDoc? A. In basket. B. MAR. C. Patient lists. D. Plan of care activity. Correct answer, D. Plan of care activity. How can a nurse use Epic ClinDoc to prepare for a patient's discharge? A. By updating the patient's flow sheets. B. By completing a discharge navigator. C. By sending a message through In basket. D. By adding a note to the patient's problem list. Correct answer, B. By completing a discharge navigator. How can a nurse use Epic ClinDoc to educate a patient about their condition? A. By using the education activity or patient pass. B. By updating the patient's flow sheets. C. By adding a note to the patient's problem list. D. By sending a message through In basket. Correct answer, A. By using the education activity or patient pass. Where can a nurse document a patient's allergies in Epic ClinDoc? A. In basket. B. Snapshot. C. Allergies activity. D. Notes. Correct answer, C. Allergies activity. How can a nurse use Epic ClinDoc to schedule a procedure for a patient? A. By using the order entry activity. B. By updating the patient's flow sheets. C. By sending a message through In basket. D. By using the education activity. Correct answer, A. By using the order entry activity. How can a nurse use Epic ClinDoc to review a patient's medical history? A. By checking the patient's MAR. B. By reviewing the patient's chart review. C. By checking the patient's flow sheets. D. By sending a message through In basket. Correct answer, B. By reviewing the patient's chart review. If a nurse needs to document a wound assessment, where would she do this in Epic ClinDoc? A. In basket. B. Notes. C. Flowsheets under LDA. D. Snapshot. Correct answer, C. Flowsheets under LDA. How can a nurse use Epic ClinDoc to request a consultation from another specialist? A. By updating the patient's flow sheets. B. By using the order entry activity. C. By sending a message through In basket. D. By adding a note to the patient's problem list. Correct answer, B. By using the order entry activity. Where would a nurse find a patient's advance directives in Epic ClinDoc? A. MAR. B. Snapshot. C. Chart review. D. Flowsheets. Correct answer, C. Chart review. How can a nurse use Epic ClinDoc to track a patient's pain level over time? A. By sending a message through In basket. B. By using the order entry activity. C. By documenting it in the patient's notes. D. By documenting it in Flowsheets. Correct answer, D. By documenting it in Flowsheets. Where can a nurse find the care team for a patient in Epic ClinDoc? A. Snapshot. B. Notes. C. Patient lists. D. In basket. Correct answer, A. Snapshot. What tool can a nurse use to track the tasks she needs to complete during her shift in Epic ClinDoc? A. Brain. B. In basket. C. MAR. D. Snapshot. Correct answer, A. Brain. How can a nurse use Epic ClinDoc to prepare for a patient admission? A. By completing an admission navigator. B. By sending a message through in basket. C. By updating the patient's Flowsheets. D. By adding a note to the patient's problem list. Correct answer, A. By completing an admission navigator. Where does a nurse document a blood transfusion in Epic ClinDoc? A. MAR. B. Blood admin flowsheet. C. Notes. D. In basket. Correct answer, B. Blood admin flowsheet. What is the first action a nurse should take in Epic ClinDoc if a patient goes into cardiac arrest? A. Open a new note. B. Update the Flowsheets. C. Activate a code blue navigator. D. Send a message through in basket. Correct answer, C. Activate a code blue navigator. How can a nurse use Epic ClinDoc to track a patient's hemoglobin levels over time? A. By checking the patient's MAR. B. By reviewing the patient's chart review. C. By checking the patient's Flowsheets. D. By sending a message through in basket. Correct answer, C. By checking the patient's Flowsheets. Thank you for studying with me, and I hope I have been able to get you somewhat knowledgeable on the Epic ClinDoc module. Please support us by following the channel and share with your friends and colleagues. More videos to come.